I won't lie, I was terrified when the doctor said those words. My feet went from beneath me, could not believe what I just heard. If I judged my condition from what I saw on television, I give up.
944,000 people are estimated to be currently living with dementia in the UK. Dementia killed almost double the number of women than men in 2020. Dementia has been the leading cause of death in women since 2011. Nine percent of people over 65 have dementia. Dementia will impact 50% of us, either through a personal diagnosis or by caring for someone who has it. $1.6 million people will be living with dementia in the UK by 2040. Dementia is the most feared health condition by 60% of people over 65. Dementia care costs in Northern Ireland are projected to increase 192% from £800 million in 2019 to £2.4 billion in 2040. Wayfinding in unfamiliar places can be more challenging for people living with dementia. Environment may affect people living with dementia more than most. Noisy and chaotic spaces can feel disorientating and overwhelming, may increase anxiety or frustration, causing changes in behaviour. Everyday life for people living with dementia can be exhausting. Though it may not be obvious to you, it takes longer for people living with dementia to process information. Our brains have to work harder to filter out external stimuli, often leaving us feeling depleted, exhausted, and spent. This makes our symptoms of dementia more evident. $74,800 people are estimated to be living with young onset dementia in the UK and Ireland. Young onset dementia is when symptoms of dementia start before the age of 65. Dementia NI members formed a working group in 2022 that included 8 individuals living with dementia, like me, supported by 4 staff members working collaboratively together, 1 from Dementia NI and 3 from the Southern and South East Health and Social Care Trusts. The members of Dementia NI are always looking for opportunities to engage with hospital and social care staff to describe what it's like to live with dementia and to share with them our challenges as well as ways we can best be supported in both clinical and hospital environments. However, speaking to every trust member in person is an impossible task, so we decided to create a documentary to help us interact with members of the health and social care services to help bridge this gap. Over the course of 22 months, we met regularly to decide the content of this film, sharing our own personal experiences across the spectrum, both positive and challenging experiences. We thought it would be beneficial to provide staff with 10 top tips for supporting people like us living with dementia. We believe these practices can be easily implemented without adding an extra burden to staff and will lead to an improved staff-patient interaction and in the long run will save time. Many people have commented, what is good for people living with dementia is good for everyone. And we, the members of Dementia NI, are sure you will find this to be so too. We know you will find the following individual experiences engaging, even if somewhat emotional at times, and that you will be able to put some of the practical tips into action.
I'm David Michael Hinney from County Fermanagh. I was diagnosed with frontal temporal dementia 7 years ago. I was aged 54.
My name is Martin Murta. My dementia is Alzheimer's dementia.
So my name is Peter Alexander. I was born in England, Twickenham, so the good old rugby place.
My name is Gerard Dorn. I was diagnosed with dementia when I was 61.
Yes, I'm Christopher Higgins, and my dementia was discovered just 2 years ago.
Yeah, my name's Alison Batchelor. I live in Dundonald and was diagnosed with Alzheimer's in April 2017.
I'm a newly diagnosed person with dementia. My past knowledge of dementia was that I was a social worker in hospital.
Hiya, my name's Tom Heatley, and I have dementia. I've been diagnosed with dementia with Lewy bodies. That was back about just over a year now.
Treat us with common courtesy. Treat us with respect as valued, capable adults. Be aware of your facial expression, tone of voice, and your non-verbal communication. And when the students came, they said, oh, I see here this person has dementia. I don't know how to speak to dementia. And I think that is the problem. They think they're speaking to the dementia. But I always said to them, so what if they have dementia, speak to the person first. You will hear a little bit when they reply about or the way they are affected, but just keep speaking to the person behind the dementia because it's the person you want to talk to.
Basically, you talk about valuing an individual. In all those years that I have been a trainer in the trust, basic values are the primary important factor.
What I would say, yes, if I was to write a book from a person who has dementia, it would be to say, I'm hurting inside too. I might not be able to express it, but I'm still the same person as I was when I was younger. I am still that today. It's just that the person I am is getting locked away more and more inside me. So don't treat me any differently. I'm still the same person as I was, even though you might have some preconceived ideas that because I've got dementia, I'm an incontinent old person, but I'm not. I was diagnosed at the age of 49, and at that time I was told that I shouldn't work anymore and that I shouldn't drive anymore because of my judgment being impaired.
Give us time. We need more time to process than you. Allow us to respond before you move on. Don't bombard us with questions.
We're just normal human beings with a good mind, just normal people. The dementia does bring up different problems, you know, such as speech. Now, my speech, while I'm sitting here talking to you, there's words just disappear out of my vocabulary, and that's why you could see me struggling there a couple of wee bits. That's because a normal conversational word, whenever it disappears, I have to fish for another word that will fit in, slot into this place. But your mind's going around like a washing machine, and it can't pick the words out sometimes.
Yeah, it still sticks with me that day. I felt very rushed, and it was very blunt. There's no easy way to deliver bad news, but it was very, very blunt, I thought. And we left with no information at all that Friday afternoon. We went out for the weekend, and we had absolutely nothing. I thought only weeks to live after that, you know. So I did, and I think more time would have helped, and maybe a bit more compassion from the consultant.
Don't make assumptions about us. Don't presume you know what we want, feel or need, or what we might be able to understand or decide. Discuss it with us directly. Give our loved ones the This Is Me person-centred document to help you care for me effectively.
Yeah, I had gone to a local NI department. Now, this would be a few years ago now, and I had said to the nurse who had, after gone through from triage, you know, been called into the back area, you know, to be waiting to be seen by a doctor and to have some sort of bloods or whatever done. And I had said to her that I had a dementia diagnosis, and she instantly dismissed it and told me, just tell the doctor, and walked away. And I have to say that put me into a bit of a panic mode, because I sort of thought, I didn't feel safe then. I sort of thought if she'd have taken a wee bit of time, even just by saying, okay, we've taken note of that, but if you need us to go to the toilet or if you need any help with anything, you know, just give one of us a shout. But I sort of felt it wasn't taken seriously, and I thought it was something that she did need to know. You know, I thought it was something that she needed to take note of and to be aware of. And, you know, as I say, I just sort of felt a bit more unsafe than if I had been given a wee bit of time, because I sort of thought, well, if I need to go to the toilet or I need, you know, who do I say to? I didn't feel after that I could say to any other nurse who came into me, by the way, I have a dementia diagnosis, because of the way she had treated me.
I learned more about dementia. I worked with people who were true professionals, who were truly impressive in their approaches, and who helped me so much to identify what I could do, as opposed to all these things that I really couldn't do.
Notes help us to remember. Provide written information using jargon-free language to help us to understand. Help us to keep notes so that we can keep track of what is happening.
For example, when I attended a hospital, I needed to meet an individual staff member who was fairly aware of dementia and helped me support on a regular basis throughout my stay, especially with regards to explaining and noting the key aspects of my appointment and how to cope well in the ward itself.
So if you have someone who has dementia, ensure that you are making clear to the individual what is being discussed, what is being agreed, and that there is someone with them that can either take notes for them if they do not have the ability to make clear any decisions that are taken, to make clear anything that has been discussed.
Environment may affect us more than you. The environment we are in affects us more than you. Provide a calming environment and opportunities to engage in activities that mean something to us. Use person-centered tools like "This is me" to find out more about me, to tailor activities to meet my needs. Specifically designed quiet places and murals can help.
There are also important issues regarding how the building itself looks. Unfamiliar surroundings, noises, and busy, unclear spaces can be challenging and lead to agitation and confusion. It's important for a dementia person to have an individual space away from others, I think. Navigation and wayfinding is also important, and it is helpful to have appropriate signs Ideally, they should be slightly large with clear words, placed at face level and not too high. Murals and painting can also be helpful. Ideally, colours that aren't too dark, such as red and green. I recently found it difficult to find a tight toilet near my bed until the staff member helped me find it, as it didn't have a sign.
But the biggest thing would be disorientation and confusion, of coming out of a room and knowing which way to turn and what way to go. And that's why for me signage is vital, in all situations. And if there's good signage, I'm much more confident and can live much more independently. I would describe my head as like a washing machine, I've so much gone through and trying to process things, that would be the biggest challenge. It's even more confusing because you're already not well, you're already worried about what's going on, why you're there, and the noise, and yourself, anybody is sort of particularly in an NE department, there's so much banging and clattering, and there's noise going either side of you, in front of you, behind you, there's so many conversations going on. Quite often now you're planted quite close to the nurse's station because there's no cubicles, and there's all the noise and all the movement sort of going on with that, and it can become very, very confusing, and it's a hard thing to process any information. And then when they come to speak to you, there's so much noise going on, there's so much background noise and conversations going on around you that it's hard to process what's actually being said to you. Whereas again, a very simple thing would be to have somewhere that once they know you have a dementia diagnosis, and to ask the person, what can we do to help? And I think most people would say, if I could have a quiet room to have whenever the doctor's talking to me, I think that would make a big difference. You would sort of know that during that important time when you're meant to be able to take information in, that they would take you somewhere that could happen easier than it does in the busy NE department. It was, again, without mentioning hospitals, it was a new hospital, absolutely beautiful, like an into a very swanky hotel, but you go in there, you're not coming back out. There is no signage anywhere, and every corridor looks exactly the same, and you sort of have to go up in the lift and go along a bit, then go down in a lift and go along a bit, and then come back up again, because of the way they're intertwined. And as I say, you come out of a lift, but there's no signage to tell you to turn left, turn right, or what way to go, and that was a horrible experience.
Well, I have had the experience of going into hospital under with an ambulance during the times of COVID. And the ambulance team were fantastic because they were aware of my challenges. They thought I had a AAA, but it actually turned out to be kidney stones. But when they took me into the hospital, rather than just sitting there in the general area, they accelerated my passage through to being on a bed in one of the cubicles, because they knew that with my behavioural variant of the dementia, of the FTD, the frontotemporal dementia, that my filters had disappeared. I would say things as I felt about them. I would swear, which I wouldn't have done in the past, but frustration, the feeling of not being able to express yourself as I once did, these things lead to just filterless behaviours. And it's not that you're being unkind or nasty to the staff, it's just how things come across. So it's important that the staff in that environment build a rapport with the patient, build the trust and the confidence where they can exchange freely and happily.
And the second time I developed cellulitis in my eye, And I went to the optician first of all. It was late on in the evening, and he rang the casualty to say expect me. So they were expecting it, and again they knew at that time I was living with dementia. So the consultant actually saw me, and the emergency department was very busy. So she actually took me to a very quiet place away from the emergency department, and they did all they had to do at that time. And her care and even the nursing care was first class at that time. Really noise and a lot of people, yeah. I find people's faces just blur, and the noise just, it really scrambles my brain. I can't think or focus on anything with noise. A quiet place would be ideal, yeah.
Assume we have capacity. Don't make assumptions about our level of capacity or ability to engage in our care planning and decision making. I may not have capacity to make every decision, but there will be some decisions I can still make and want to make. Don't speak to our family members and ignore us. Speak directly to us first and allow us to defer to our support person if we need to.
Ask me what you need. I would want them to ask me what I needed or wanted, not to presume they know, because they might have had somebody in earlier that day or the day before or the week before with a dementia diagnosis who needs something different to what I would need. So I would always say, treat that person as an individual and find out what you can do that will make them more comfortable, feel safer, and in the turn that will ease your workload, because if the person with the dementia diagnosis feels relaxed and feels at ease, they're less likely to be given hassle or be kicking off about something.
I was sitting in the outside waiting room when she asked me could I come into the room and I'd speak to you. If you want your son to come in, you can come in. I says, no, I'll just go in myself. And when I went into the room, she was quite shook my hand and says to me, Martin, I'm sorry to tell you, I'm not sure the exact words, but you have Alzheimer's dementia. Well, you're taken back. It's shocking. She says, do you want me to get your son, bring him in? And I says, no, nah, definitely not to my son. I'll get my sons together when I go home and I'll tell them when I go home. I got them settled down and things. I says, look, I'm grand. I still feel the same thing. I'm still your daddy. I'm still the thing and I'm still carrying on. And two of my sons are two messers, twins. And they were going, oh God, not be able to tell him anything now. Not keep a secret. He can't keep anything. But it was good. The experience was good.
Be aware of our details. Don't make us repeat our story multiple times. It makes us feel like we are being tested. Read your colleagues' assessments. Repeating information is exhausting for us.
Yeah, again, I think that's it. The nurse comes in, you see the nurse in triage, you tell them the story. You then see whoever you move to into cubicles or into the back bit of the NE, you tell them your story. The doctor then comes in, or a doctor comes in, and you tell them it, but they're maybe not the particular doctor you need to see. If it's something specific you're there for, if it was, for example, something to do with your heart, you would get a general doctor come in and talk to you, you need to, we need to get somebody down from cardiology or whatever. They come down and you have to repeat the whole thing again. And that can become quite frustrating, and you sort of think, can you not read? Can you not actually look at the notes that have been taken umpteen times beforehand? And you sort of think, are they trying to trick you out here? They're trying to get you to say something different to what you had said before. I think it is. I think it's a challenge, because, as I say, by that stage you're already in a real state of confusion and panic and a bit more unsettled, so to be asked the same story over again can become very frustrating. And I think at times then, I think you can become a bit sharper than maybe what you would normally be, but it's because you sort of, you're fed up with the length of time you're sort of sitting there probably waiting anyway, and you haven't seen anybody, and then the next person comes in and asks you exactly the same question again. You sort of think, like, this has moved on nowhere. You know, you haven't, you know, you're asking me what the person asked me 2 hours ago, but you're doing nothing different. But yes, I think it is a challenge, you know, I think it's a challenge for anybody, but I think for somebody with a dementia diagnosis, yes, it is more of a challenge.
Use clear language. If you are going to perform an intervention, talk to us beforehand and explain each step in clear words or with gestures if our understanding is very limited. Give us time. Explaining the procedure will help us to participate. If I need reassurance, reassure me. And I'm not saying you have to have dementia to understand it. What I'm saying is, what I said to students is, take it easy at the beginning. Don't bombard them with a rapid release of questions, and don't link questions together. Make the subject, if it is driving, something like that, say, are you driving your car? Wait for the answer, and then if they say, no, I'm not, then you can discuss it with them. But I think if you go into something you know, it only makes them, I can't interrupt this, but I don't agree with her. So very gently say, look, thank you very much for coming to talk to me, and I know very little about how you're feeling at the moment. So can you tell me how you felt when you got your diagnosis? What went before? Did you think you had dementia? And how you felt when you actually were told you have dementia. Makes a difference.
Health and social care staff working with any form of dementia need to communicate clearly with any individual with any form of dementia. They need to give clear instructions. They need to ensure that people with whom they are working have a clear understanding of what is being discussed, and that they have made clear exactly what is being shared, what is being said.
Maintain our confidentiality and dignity. Share information with us sensitively and take into consideration our confidentiality. Privacy and dignity are important. We may not want other patients, visitors, to know we have dementia.
Yeah, within the hold of dementia, I found myself falling apart. I found myself unable to be the person I was, to communicate the way I should be able to communicate. I lost my skills. I lost a lot of what was But being me as a person was I was lost.
Well, for myself or anybody, if they just treat us like an ordinary, if I come in as a patient, they don't know I've got dementia unless I tell them I've got dementia. Don't have me to have to say that I've got dementia. Just treat me with courtesy. If things, most sitting rooms in the hospital, you know, are like they're havoc. If it comes to a thing, many of the places I've been in, I've turned around and says, "Look, I'm in the early stages of dementia. Could you give me a wee bit of time here?" And just things get mixed up very. If they could just, if my name would come up in that computer without me having to say, and 200 people or 100 people behind me listening, he's got dementia. He's different. No, it's different. Just come up in the computer. Then right away they know they've got dementia. Where we're just talking about a blue heart or a purple heart or something like that. And to see what way the attitude changes. It does change. I've used our wee thing card and our wee ID. I've used a wee smart card. Not the smart card, jam card. I've used the jam card. The difference those things make and change people's attitude, it's wonderful, wonderful.
Provide a support person. Having a designated support person can help to keep us calm and reassured. One key person who supports us through our stay makes a huge difference to our hospital experience.
I had to go and get an operation to take out a tumour on my leg, and it was quite difficult because the specialist, even though she was taking the tumour out, she was quite, a lot of words that she was using was very difficult for me to understand because they were quite technical. And she then got a young nurse to come in and help me, because she also knocked me out for 6 hours. She put me asleep for 6 hours where she was, and a lot of things she was the other lady was helping me. She met me, I was there for about a full day, overnight, and that young lady was a major help to me in the hospital because she helped me even write down my words. She helped me even find places, and she also said, even tomorrow when you go home, now that you've been operated, this is what you do. So even though the specialist operated me well, that lady was a massive helper. She made the difference, and because I spoke to the specialist and even used my card and said, I know you're going to help me, but I've got Alzheimer's and I need someone to talk to me that give me advice, and because some of the things you've said you're going to do, I haven't really understood fully what's going to happen or even how I help myself. So, and when that other lady came in, she was massively helpful to me. Possibly like other people with dementia, I find it sometimes difficult to understand if I haven't heard about things for a while. So that other lady was a bit more explaining and also helped me make notes to write down a great understanding of what was going to happen to me, and particularly how I dealt with myself the next few days when I got home.
Having that interface between the consultant and also the patient with that specialist nurse was invaluable, and that I think is something which can be really helpful to other people.
One thing that I would insist on would be that I had someone with me that I trust, someone with me that could be there to, like I say, I would either be taking my own notes. That's another thing. I'd lost my writing skills. I'd lost, as well as losing my verbosity, I had lost my ability to write. And I have been practicing writing just to get myself back up to speed, to be able to communicate effectively. I've also been reading a lot to try and ensure that my communication is as it should be, as I consider it should be. Because I'm a hard taskmaster.
The following scene is based on our real life experiences of poor healthcare interactions. Without a clear introduction, we may feel rushed or panicked, unsure of what is happening, which may unnecessarily increase our anxiety and generate unexpected reactions. Insufficient support with wayfinding can leave us disorientated and confused, ultimately reducing our powers of concentration for the following appointment. Disorganized and chaotic clinical space may be distracting or overwhelming for us, reducing ability to focus and communicate. Not explaining procedures or interventions clearly in advance can cause us upset or distress, especially as our dementia advances. Not explaining next steps in advance increases our anxiety and confusion.
Hazel and David, is that right?
Yeah.
I'm Dr. Southwell.
Without a clear and full introduction, we may not realise the purpose of the appointment.
No, I'm not really seeing anything there. There's no results back just yet.
Poor positioning can hinder effective communication with us. Asking us repetitive questions without context can make us feel like we are being tested. Speaking to our carer instead of directly to us shows a presumption about our capacity. The following scene is based on our real-life experiences of positive healthcare interactions.
Thank you. Wait a sec. Okay. The consultant comes, okay, and I'll feed this across to him.
Yeah.
All right. There we go. If you just like to wait, the consultant will be right in through the door then, okay? Thank you. Okay, see you in a bit. Nice and relaxed.
How are you? I'm Dr. Southwell. I'm one of the consultants. It's nice to meet you.
Oh, yeah.
It's Davey, is that right?
Davey, yeah.
Davey, I haven't met you before. I understand that you're here to talk about some results.
That's right.
Is that correct? Are you okay?
Yeah, sure. I haven't been doing too bad. I've been keeping busy and very active. So I do, and yeah, just keep busy.
Okay, okay. How have you been sleeping recently?
Sleep's been a bit on and off, but I always get caught up. Sometimes I wake quite early,
Right.
but I can get caught up the next night.
Okay. And what time would you go to bed at roughly?
Normally try 10:30, 11 o'clock. Probably a bit overeating if anything.
Right.
I've started sweet stuff. I can't get enough at the minute. Whatever's going on, you know.
Right. Okay. And then just about some of your medications, has anything changed recently at all?
No, they've kept it. They kept the medication as it is.
Right.
Yeah.
We could maybe spend a bit more time looking at.
Really not too bad. Just how do you see things progressing for myself?
Okay. Okay.
So if you've got that rapport, it makes a real difference, and show appreciation, because the staff do an amazing thing and in very difficult environment. And I have to say thank you to the nursing staff and to the medics who do take such good care of us.
Thank you for staying with us throughout this documentary. We hope it has provided you with a deeper understanding of what it is like to live with dementia, and has offered practical tips that you can now put into practice. Finally, a big thank you from all the members at Dementia NI for the work that you do that has a positive impact on the daily lives of real people like us.
Have to assume we have capacity. Is that the size of my bladder? The size of my nose? Do you know?
I won't lie, I was terrified when the doctor said those words. My feet went from beneath me, could not believe what I just heard. If I judged my condition from what I saw on television, I give up. It's a slippery road, but I keep my feet planted. I have the strength to hold the cards I've been handed. If I stumble, if my feet fall, or if I need some assistance, I know the journey's long, but it's worth that distance. My voice is mine, I don't need someone to say what's on my mind. Though the love I have to help me is the best that you could find. And I worry for my loved ones, 'cause the future is the one. No, I stay strong. It's a slippery road, but I keep my feet planted. I have the strength to hold the cards I've been handed. If I stumble, if my feet fall, or if I need some assistance, I know the journey's long, but it's worth that distance. I found my place, I'm surrounded by faces who understand me. Our worries and fears soon disappear after a conversation. And I want cup of tea.